Ketamine, miracle drug or double-edged sword? I'm your dope dealer, and this is the Ketamine Conundrum, Part 2 of a DNN special report. The high-profile death of actor Matthew Perry and subsequent prosecution of those who supplied him compelled Psychiatric News to ask whether ketamine's risks outweigh its benefits, and found even opposing viewpoints somewhat aligned along the harm reduction front. Keith G. Rasmussen, MD, Mayo Clinic psychiatrist and author of Ketamine, Modern Psychiatry's Most Fascinating Molecule, said that the medication is generally safe and effective for refractory depression. However, what's most important for patients is to receive a thorough psychiatric evaluation at baseline, during, and after a course of ketamine to rule out current substance use disorder or psychosis. Paul S. Applebaum, MD, the Dollard Professor of Psychiatry, Medicine, and Law at Columbia University, is concerned that patients may not be fully informed of the risks and lack of evidence about the off-label use for psychiatric disorders. It raises the question of whether some physicians are ignoring their ethical obligations to patients for their own financial benefit. Elie G. Aoun, MD, Assistant Professor of Clinical Psychiatry at the Center for Law, Ethics, and Psychiatry at Columbia University, said that the research showing the best outcomes has paired ketamine infusions with psychotherapy involving a therapist specially trained in its use. This is the method touted by the Ketamine Research Foundation, which recently published its guidelines for the safe personal use and effective clinical use of ketamine. Most people are simply left in a room by themselves during their infusions, with a technician occasionally checking in on them, Aoun continued. That by itself is not sufficient. And what about the cost? One dose of ketamine, decades off patent, costs less than $1, yet patients are typically charged $400 to $900 for a single infusion, substantially higher than the traditional physician appointment. So there is certainly a financial incentive to offer this. Virtual sites are now peddling ketamine as a treatment for nearly everything: panic, post-traumatic stress, anxiety, bipolar spectrum, and substance use disorders, as well as neuropathic pain and restless leg syndrome. One major telehealth provider offers ketamine to individuals who are merely feeling stuck, trapped, and listless, according to the company's website. The provider also states that ketamine works by fueling neural growth, stimulating neuroplasticity, and fertilizing the brain. G. Caleb Alexander, MD, MS, co-director of the Center for Drug Safety and Effectiveness at Johns Hopkins, says, when you really carefully examine the quality of the scientific information about ketamine or S-ketamine and its potential value, the evidence is slim. Even with FDA-approved Spravato, only one of Janssen's 3 Phase 3 trials demonstrated a statistically significant benefit for treatment-resistant depression at 28 days. Its other 2 trials did not. If you're talking about giving someone one dose, one time, to knock them out of a truly, profoundly disabling treatment-resistant depression, that's one thing, Alexander said. But if you're administering ketamine to someone who has failed an antidepressant or 2, and then repeating the dose week after week for an indefinite period, that's a different story. Unfortunately, that dosing regimen is not what's been studied in most of the research. And what's not ambiguous about ketamine are the potential risks. There's lots of evidence that ketamine is toxic to neurons, and it's toxic in a dose and duration-dependent fashion. It all comes back to knowing your dose, why you were taking it, and the risks involved. Which is why the Ketamine Research Foundation published their guidelines for the safe personal use and effective clinical use of ketamine. You can download these guidelines from the link in the description or on our Substack, where you'll find my deep dive on ketamine. Got some news for DNN? Share your thoughts in the comments. Like, subscribe, share, visit us at dnn.buzz. Having trouble with ketamine? You're not alone. Reach out for help.